Talk a little bit about when we should take take a pain seriously. A lot of people say, I've had this thing that's been bugging me for a day or two, and then it turns into a week or two, and then longer. When do we need to say, okay, I need to really look at this?
Well, I mean, certainly pain there are some danger signs for certain pains.
Mm-hmm.
You know, if you have chest pain that's crushing, even if it's been there for 10 seconds, if it's not gone by the time you've gotten to the telephone, do dial 911. There are, sudden new onset of headache. Have that investigated. If you're certainly over the age of 20, that should be looked at by a physician to make sure there's nothing else going on that's truly serious. But we all live with a certain level of pain past the age of, I don't know what, maybe 2. We're used to reconditioning pain, so we use some new muscles. They start to get sore and achy, but then they get better over time. If they don't get better over time, and say you're going running every day, and week by week you're getting worse and worse instead of it's getting easier and easier, then there's something that needs attention. I'm not saying it's anything terribly serious, but you might be causing excessive wear and tear because, for example, your feet may be aligned in a particular way that puts too much stress on your knees or your hips. It might be overusing certain muscles, overusing certain joints. So see a physical therapist, a chiropractor, a massage therapist, a sports doc, a lot of different kinds of people you could see that could help with that. And then, for a lot of the chronic types of pain we have, I mean, a big one these days is fibromyalgia, what gets called fibromyalgia, and that's a very, very big topic that's very confusing because there are so many factors that are involved. People with fibromyalgia almost always have pain, and their nervous systems are extraordinarily sensitive to pain, so that if you touch their muscles lightly, they're experiencing pain. And when you put people with that condition into a functional MRI device that measures pain, it measures that they're feeling pain. It's no different than if I was being poked very hard to induce serious pain. That's the same brain picture that happens there.